Good morning, you're tuned into the Wire's daily COVID-19 updates. Today is the 15th of June. More than 11,000 people contracted the virus in India in the last 24 hours. The total number of cases is now more than 3,32,000 and over 9,500 people have died. The total number of cases in India rose from 2 lakh to 3 lakh within 10 days. India took 64 days to cross the 1 lakh mark from 100 cases. In another fortnight, it reached the milestone of 2 lakh cases. India has now become the fourth worst hit nation by the pandemic. Cases in Jammu and Kashmir have breached the 5,000 mark. In the last 24 hours, the Union Territory recorded 163 new cases. In West Bengal, cases have crossed the 11,000 mark and the official death toll is 475. Uttar Pradesh's tally of coronavirus cases has been rising by over 500 cases daily. The state has recorded over 13,000 infections so far and reportedly 300 people have died. 67-year-old former Pakistani Prime Minister Yusuf Raza Gilani tested positive after attending a hearing at the National Accountability Bureau in a corruption case. Gilani's son announced this news on Twitter. Former Pakistan cricket captain Shahid Afridi, last seen on the field in a Pakistan Super League in March, has also tested positive for the infection. The Maharashtra government has capped the maximum price of COVID-19 tests at Rs 2,200. Earlier, the price of a COVID-19 test at a government or a private lab was Rs 4,500. Union Home Minister Amit Shah held a meeting with the Delhi Lieutenant Governor Anil Baijal, Chief Minister Arvind Kejriwal and others on Sunday to discuss the COVID-19 situation in the national capital. The meeting was scheduled in the wake of rising coronavirus cases in New Delhi. Early in the day, in a series of tweets, Amit Shah wrote that the Modi government is committed to control the spread of the virus in Delhi. He also said that the central government will provide 500 railway coaches to Delhi in the view of shortage of beds. A comprehensive house-to-house health survey will also be done in Delhi containment zones for COVID-19, he said. Amit Shah also added that for the treatment of COVID-19 in private hospitals in Delhi, a committee has been formed under the leadership of Dr. V.K. Paul. This committee will provide 60% of COVID beds in private hospitals at a low rate, he said. Today, Amit Shah will also hold an all-party meeting in New Delhi. According to a study which the ICMR was also a part of, the peak stage of COVID-19 in India may arrive around mid-November, during which there could be a paucity of isolation and ICU beds and ventilators. The study is conducted by researchers from an operations research group constituted by the ICMR. It said that the implementation of the 8-week lockdown, along with strengthened public measures, delayed the peak of the pandemic by an estimated 34 to 76 days. Reportedly, this has allowed time for the healthcare system to shore up resources and infrastructure. Earlier, the director of AIIMS, Dr. Randeep Guleria, told the media that the peak stage in India will arrive in mid-July. Even as researchers along the globe race to develop a vaccine to tackle the pandemic, Acharya Balakrishnan, the co-founder and the chief executive officer of Patanjali Ayurveda Limited, claimed that his company developed an Ayurveda medicine that has cured COVID-19 patients within a span of 5 to 14 days. According to ANI, Balakrishna on Saturday said that the trial was conducted on hundreds of COVID-19 patients and that the medicine has yielded 100% favorable results. India has revised the protocol for clinical management of COVID-19 to include the use of remdesivir and convalescent plasma therapy on specific groups of patients. The list of symptoms has been revised in the new protocol to include the loss of smell and taste. Remdesivir, which is one of the most keenly watched in research for a cure for novel coronavirus, is part of the World Health Organization's ongoing solidarity trials. Remdesivir has also received emergency use authorization by the US FDA in May. The global death toll crossed the 4,30,000 mark yesterday and more than 76 lakh people have now contracted the virus around the world. France's highest administrative court ruled on Saturday that the virus concerns no longer justifies the banning of public protests. This decision will now allow protest, marches and demonstrations to continue as long as health measures are respected and followed. Reportedly, the events need to be declared in advance to local authorities. This ruling came after the police stopped at least 15,000 protesters fighting against police violence and racial injustice through the city on Saturday. Coronavirus cases continue to rise in the African continent, and African leaders have told the media that China is ensuring the supply of 30 million testing kits and over 10,000 ventilators to the continent each month. The head of Africa's Center for Disease Control and Prevention said that each country in the continent will be given a share based on their population and the number of coronavirus cases. That's all for today. Thank you for watching. Keep reading The Wire and The Wire Science. To watch more videos, don't forget to subscribe to The Wire's YouTube channel. We will see you tomorrow. Until then, stay safe.